Typically, patients come to see me in the clinic to look for rejuvenation surgery of the face, and this can range from a simple skin excision just in front of the ear to a full facelift with scars extending from the hairline in the temple down the front of the ear, behind the ear and into the hair at the back.
Facelifts are common operations. They are done commonly. However, they are not easy to do, and we are fortunate that we are able to offer the whole spectrum of facelift surgeries. The simplest of these surgeries is a minor cheek tuck, which can be done under local anesthesia, whereby under local anesthetic your skin in the lower cheek area is pulled up. One ends up with scars in front of the ear, which usually ends off at the lower part of the ear. However, this very rarely is able to solve problems that one has with the upper third of the face and also the neck area. Patients often ask me if there's one thing that they would like to have done, what would I suggest that they have done? And invariably I find myself telling them to have their lids done, or the upper and the lower lids done, more commonly the upper lids done. In my practice, I find the upper and lower lid blepharoplasty to be a surgery that rejuvenates the face, and indeed is a fairly low stress operation with very high results. And the patients get a significant difference very quickly. The operation, as far as the upper lids are concerned, involves an incision in the upper crease of the upper lid, whereby the skin is removed along with the muscle in the upper lid, following which some of the fat that is there in the upper lid area is reduced.
It's a very straightforward operation to remove that excess skin, leaving a scar in the eyelid crease, and this can often be done under local anaesthetic as a day case. The lower eyelids are a bit more technically demanding and a little bit more tricky, and typically I do those under general anaesthesia. And these involve lifting up the skin of the lower eyelid and removing any excess fat from the bags under the eyes, and then tightening up the muscle and skin, removing any excess.
The scars following blepharoplasty or eyelid surgery involve a scar along the upper lid crease and a scar at the lid margin in the lower lids. Scars are very predictable, and they're predictable if not for the only fact that they settle down very nicely. And I don't think in my practice in the last 10 to 12 years I've ever had a problem with the upper or lower lid scar. So in that way we are lucky that the scars heal very nicely, and indeed in a couple of weeks' time one is able to put makeup on and they're hardly visible. The commonest operation that is done with facelifts nowadays is something called a MAC facelift. Now this MAC stands for a fairly esoteric thing which is called minimal access cranial suspension, whereby under general anesthetic your skin is raised off your deeper layers of the face. Following that, some stitches are put into the deeper tissues to tighten and lift the face up. Often 2 to 3 stitches are put in which lift the middle of the face and also the neck area up. One ends up with scars in front of the ear, which goes round the ear at the lower part of the ear and to the back of the ear. MAC facelifts are common, and they are commonly done in Britain nowadays. And they give fairly predictable results with predictable longevity, and one can expect to set the clock back by about 5 to 7 years following a MAC facelift.
Smash lifts are slightly more advanced than this, with the extension round behind the ear and into the hair at the back, which give more of a neck lift in addition to the facelift. Typically patients are in for 1 to 2 nights and can be off work for between 2 and 4 weeks.
The results following smash lift are fairly similar to the MAC lift.
The scarring is usually well hidden in the temple and just in the skin crease in front of the ear, and then down to the earlobe for a MAC lift. For a smash lift, this usually extends in the crease behind the ear and into the hairline behind.
Facial surgery comes in different intensities. As far as facelifts are concerned, I would say that my patients usually need 1 to 2 nights of stay in hospital. while after a blepharoplasty, patients are usually able to go home in a few hours if they're only having a local anesthetic for the upper lids, or they need to stay in for one night if they're having upper and lower lids done.